Howdy y'all, welcome to today's podcast. In today's podcast and video, we'll be talking about your gallbladder and what you need to know about this. The gallbladder is an organ that causes literal pain and leads to millions of visits all across the year in the United States. We'll talk about in the first segment, patient story about a patient who had their gallbladder removed and what we did to help them out. We'll discuss in segment number 1, what is the gallbladder? Number 2, we'll talk about common gallbladder problems. Number 3, we'll talk about what happens when you get your gallbladder removed. Segment number 4, we'll talk about life after your gallbladder removal. And at the very end, I'll discuss what you can do to support your gallbladder after surgery as well. If you're joining us for the first time, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I've over 10 years of treating thousands of patients, literally thousands of patients who have had all sorts of gallbladder issues. If you want to come see us, find out what's going on. Our core values, find out the root cause of what's going on, get you feeling better. No pill for every ill, so we can find out what we can do to get you feeling better. You don't need a referral. We can see you today. In fact, I can almost guarantee you we can see you within 24 hours. So come see us. We can find out exactly what is going on. So the gallbladder typically is an organ you don't think about until it's causing you to cause pain. It can act a fool. And the gallbladder is also an organ that causes millions of ER visits every single year. In fact, it's the most common surgery that we currently do in the United States for a variety of reasons. And I have a lot of patients who come see me because they're worried about the gallbladder and they don't quite understand what is going on when it comes to the gallbladder issues. So stick with me in this video because I'll go through the workup of what we do to get patients feeling better and understand what's going on with the gallbladder. So we'll talk about a patient story. I had a patient who came to see me who was having issues months after their gallbladder was removed. So initially, this patient was going to see his PCP for pain on the right upper quadrant. That came and went. That pain was on that right side, but it radiated to the back and got to a point in time where the pain was so severe, they had to go to the emergency room. And in that emergency room, the patient actually ended up having pancreatitis. Now, there's two main causes of pancreatitis. One is alcohol, but the second leading cause is gallstones. And in the workup of trying to find out the cause for the pancreatitis, it was found that the gallbladder had some stones. And so, rightly so, the patient saw a surgeon, they got the gallbladder removed, and subsequently the pain went away. But the patient noticed after a couple of weeks, oh my gosh, I'm getting worsening heartburn, worsening bloating, my bowels are irregular, I'm running to the restroom, having diarrhea, what is going on? And he went back to his PCP, they tried all sorts of medications, dietary changes, things did not get better. They couldn't figure out what is going on, why this patient was having so many issues after the gallbladder was removed. He thought, oh my gosh, I'm supposed to feel so much better because my gallbladder is gone, but it was not the case. So he came to see me, and I knew right away what was going on. This is a classic case of bile acid diarrhea. So what happened in this case, in millions of people, is that your gallbladder is an organ that's there to store bile. So you don't always secrete out bile. You only secrete it out when you need it. But when the gallbladder is removed, guess what happens? You don't have that storage organ. So bile is continuously dripping out like a leaky faucet to cause what's called bile acid reflux and bile acid diarrhea. Your colon does not like bile, and it causes these symptoms to occur. So in this case, simple fix, we took a look and I confirmed this, and we gave the patient medications and dietary recommendations to stop the bile acid diarrhea. So let's go into more details exactly kind of what we did. So second number 1, what is the gallbladder? The gallbladder is a pea-sized organ that sits right under the liver in the right upper quadrant. You don't notice it until it causes problems and acts a fool. But the basic function of the gallbladder is to store bile. Bile is produced in your liver, and it goes through these ducts, almost like pipes, all throughout the liver, and it goes into the gallbladder. And your gallbladder is that organ that stores bile, almost like a septic tank. Now, your gallbladder will contract whenever you need bile to be released, especially when you have fatty foods and greasy foods. Bile is the ingredient in your body to digest those foods. So you have a hamburger, you're like, I feel so full. What is going on? Your gallbladder squeezes out that bile and it starts the process of digestion. And that's what that gallbladder does. But what bile also has, it has ingredients in them that can make things more sludgy and eventually form stones as well. And so For some individual, if the gallbladder is either not working properly, working too much, or because you have a lot of fat, you can clog up that gallbladder, clog up those pipes, and that can cause gallbladder issues and gallbladder pain as well. So let's go into segment number 2, common gallbladder problems. The first problem are gallstones. Gallstones commonly can form because you have sludge and sediment that's part of the biliary system that gets caught up in these pipes. It's exactly the same analogy as pipes in a toilet plumbing system. You have some clog in there, and that backflows all that fluid. Same thing when you get that same issue in the bile ducts in the gallbladder. You have some stone that blocks everything up. So you have this backflow of bile, and that can lead to what's called biliary colic. That's that typical pain that my patient had, right upper quadrant pain that comes and goes. That can radiate to the back as well. And when your gallbladder's having that and it's squeezing against that blockage that's there, that causes the biliary colic to occur. And that's your sign that your gallbladder may not be working correctly. Now, consequences of that could be you can develop fevers or an infection called cholecystitis, and it can also lead to pancreatitis as well because your pancreatic ducts are around the same area. And so if there's backflow of that bile going to your gallbladder, you also have that irritation going to your pancreas to inflame the pancreas, and that's why you can develop pain in that epigastric area as well. And so if you start to have that pain called biliary colic, or you start to have pain that's epigastric, radiates to the back, that can lead to problems with your pancreas and problems that are going on down below. And if that's the case, this may be the indication for you to get your gallbladder out. But the issue is that our bodies don't act like a textbook. And so not everyone presents the same. So for example, I had a patient who came to see me who was complaining of bad indigestion, like, oh, I have some pain, it hurts, it's burning, and it's kind of in this epigastric area. I don't know what is going on. And these are kind of non-specific symptoms. So we did a workup, did an upper scope, didn't see anything worrisome there, did some imaging, and lo and behold, we saw in that case, the gallbladder was chock full of stones. Now, because this wasn't a typical biliary colic, I thought, all right, this may be worthwhile for us to consider having you see a surgeon. So we did. The patient actually ended up having rip-roaring inflammation of the gallbladder, which we couldn't tell on the imaging. Got the gallbladder out, and the patient's indigestion got better. And so, even though I'm telling you about these typical symptoms, the gallbladder can present as kind of atypical symptoms as well. Sometimes it's hard for us to really understand what those symptoms are for some individuals. Which leads to segment number 3, how to remove the gallbladder. The only way to fix gallbladder issues is surgery. Now, people may tell you, you can take things that can dissolve the bile, dissolve the gallstones, take some supplements. Unfortunately, there's no evidence for that, and there's no evidence it works. We have tried to do this. Listen, man, I'm in the GI field, and if I can avoid the need for surgery for people and have them take something naturally or medication-wise, I'm all for that. But in this case, there's no evidence for that. And so what we have to do is we have to do surgery. Now, surgery has changed dramatically from where it used to be. Now, it's a very routine surgery, typically laparoscopic, a couple little incisions, takes about 45 minutes, get the gallbladder out, and you're done. Now, with like any surgery, there can be complications, but it's been dramatically much safer, much easier, and easier to tolerate. In fact, gallbladder surgery right now is the most common surgery done in the United States. We have a lot of data on the safety of this. And so if I have a patient who has typical gallbladder issues, or they have gallstones causing problems, or they have cholecystitis or inflammation in the gallbladder, or if their gallbladder is causing other problems like pancreatitis, these are the indications to absolutely get your gallbladder removed, because once you've had issues with your gallbladder, it's not a matter of if, but it's a matter of when. And it's much better for us to do this on an elective process than in an emergent process, because there could be some times when we have to get your gallbladder taken care of emergently. That's never a good situation, either for the patient or for the physician as well. Now, keep in mind, when you get your gallbladder removed, you're still producing bile. So we'll go into segment number 4, life after gallbladder removal. Now, I'll preface this. A lot of patients do fine. They really do. And they feel better, and their symptoms go away. So I don't want this to be a video of you being scared of getting your gallbladder removed. It is safe, it is worthwhile, and it's something you may need to do. However, there are some individuals that have issues with that. So number 1 is bile acid reflux. Very similar to this patient I talked about before, your organ, your liver, will still produce bile. It produces bile all the time, but it has no place to store it. So you are constantly leaking bile from your area that used to be the gallbladder. And that bile can go into two different places. One place it can go into your stomach. It's called bile acid reflux. And with that, I can see that on the upper scope. I can actually see yellowish bile in that stomach. That can cause inflammation, irritation, gastritis, heartburn, abdominal pain, indigestion. And typically, these symptoms don't get better on acid reductive therapy, PPIs, because it's not an acid problem, it's a bile problem. And we have to give you bile acid binders instead and dietary options to get that taken care of. Problem number 2 is bile acid diarrhea on the other end, because the bile can also go to your colon. And your colon does not like to absorb bile. It does not like to have bile in it because it irritates the colon to cause diarrhea to occur. And if that's the case, you may not be responding to other treatment options when it comes to getting your diarrhea taken care of. In fact, the most common side effect or problem with getting your gallbladder removed is bile acid diarrhea. And it's not going to be fixed by, giving you typical treatments for IBS. So in this case, once again, we'll give you bile acid binders. We'll bind up that bile to get rid of it so it doesn't get into your colon and allow you to have, better bowel movements. That's what we did in this case. It was an easy fix for this patient. We treated them and we gave them some bile acid binders. They felt so much better as well. Number 3 is that it can actually cause scarring of where that gallbladder used to be. And so I have a lot of patients who later on down the road, because of scarring, they feel that same gallbladder pain on the right upper quadrant. And that's hard for us to test. And so sometimes we have to do further testing and diagnostic to open up that scar tissue that's there. Now, a common mistake I see, in fact, the number one mistake I see when it comes to patients who get their gallbladder removed is that they think they can eat the same, and they can still think they can eat the fatty foods, the hamburgers, what they had before. And what I tell you is that you need to use this as a way to make the dietary adjustments to get you feeling better. If you're the type of person that normally ate fatty food all the time, we normally had, hamburgers, shakes, greasy foods, that's probably the reason why your gallbladder acted a fool. And this is what we need to do to eliminate that, is that you need to eliminate those particular foods. You need to eat better. You really do. Because once your gallbladder is gone, you minimize or you lose the capability to get that taken care of for you, which will make things a lot worse for you down the road. So don't make the assumption that things will be the same in terms of diet. Don't do that, because you need to make the change to hopefully get you feeling better. Which goes into our segment number 5, the last segment. How do you support your gallbladder after your gallbladder has been removed? Because you literally removed an organ from your body. Here's what I tell my patients. Number 1, as always, remove or eliminate all the greasy and fatty foods. They're not good for you. But when you had your gallbladder removed, you don't have that barrier that will normally hold that bile in there. It's gone. And so you're just continually leaking out bile. And bile is triggered by high fatty foods, by greasy foods. So try to minimize that as much as you can. Number 2, add in more fiber, especially soluble fiber. Soluble fiber will help bind up that bile and to allow you to not have so many issues, but also is good for you. Fiber in itself is good for your gut. It's improving your gut microbiome, and we need all the help when it comes to our gut microbiome as well. Number 3, consider some supplements that can help out with bile. We actually offer supplements in our office that can actually help out with bile issues as well. So if you want more information on that, come see us on that as well. And then lastly, staying hydrated is critical. We need to see if we can flush out that bile from our body. So if you're not improving your hydration, see what you can do to hopefully help out with that as well. So that's kind of the summary. And the big thing I want you to know is that your gallbladder is useful, but it can act a fool, and it may need to be removed. And if that's the case, that's perfectly fine. And hopefully you can find out what we can do to get you feeling better, but also hopefully these tips will help you to improve what's going on in your gallbladder as well. Now, in the next section of this podcast, I'll explain why your gut can feel out of balance after gallbladder removal and which foods you should incorporate and remove to hopefully get you feeling better as well. So briefly before we begin, let's discuss exactly why do you need to get your gallbladder removed. So your gallbladder is an organ that sits right near your liver on the right upper quadrant area of where your abdomen is at. Now, there are a number of different reasons why you need to get your gallbladder removed. So for example, you could be having stones in your gallbladder that can cause you to have severe pain on the right side. It's called biliary colic. That's pain that comes and goes that can radiate to your back. Or maybe your gallbladder is not working correctly. Or maybe you found out your gallbladder is actually acting up and causing a fool and causing all sorts of issues. But millions of people get their gallbladder removed. And sometimes their gut can act all crazy after your gallbladder has been removed. Your gallbladder is an organ to store bile, and bile's main function is to metabolize fat down to its smallest component so you can absorb those fats and use them for your everyday living. If you've had your gallbladder removed, what happens is that you have actually too much bile in your body. You don't have the organ to regulate how much bile gets secreted. So you have bile that can go into your small intestine, you have bile that can upchuck into your stomach, and you have bile that can go into your colon to cause severe diarrhea, cramping, and pain to occur. And this is why for a lot of my patients that have had their gallbladder removed, they don't feel any better, or they have worsening gut issues after their gallbladder has been removed. The first food I recommend to avoid are fried and fatty foods. Keep in mind, like I mentioned before, your gallbladder is the organ to store bile. And if you don't have that organ, that bile is going to upchuck into your stomach or go downstream into your colon. So when you have a lot of fried and fatty foods, your liver is going to produce more bile, and more bile is going to go into your gut to cause worsening GI issues. So if you can minimize the amount of fatty foods and fried foods, that's going to make it easier for your gut to settle down after your gallbladder has been removed. So avoid foods like French fries, hamburgers, fried chicken, the foods I know that you want to eat but are not good for you anyways. At least this gives you an excuse to maybe try something different. Number 2 are high-fat dairy. Once again, whole milk or cheese or any foods that have a lot of fat in them, especially dairy, will stimulate the production of bile to cause more to be released inside your GI tract. So if you can minimize those foods, that's going to minimize the amount of bile being released to hopefully minimize the post-cholecystectomy gut issues you may be having. So this includes foods like full-fat milk, cream cheese, and butter. So instead of having this, I'm not saying to eliminate them completely, maybe go for a low-fat alternative or even a plant-based derivative. Number 3, processed meats. These are not good for you anyways. Things like sausages, bacon, and processed meats are high in fats and should be avoided. It'll make it more difficult for your body to process without a gallbladder. Number 4, caffeinated and carbonated drinks. Caffeine and carbonation can irritate your gut. It can stimulate the GI tract to produce more bile, more peristalsis, and make worsening GI issues after your gallbladder has been removed. So try to cut back on those sodas, those coffees, and those energy drinks. And tip number 5, spicy foods. Now, while everyone's tolerance for spicy foods can be different, if you start to notice you're having worsening symptoms with spicy foods, this may be what's going on because it stimulates more production of your bile. So now that I talked to you about what you should be eating, here are the foods I want you to incorporate after you've had your gallbladder removed. This will help out to soothe your gut and get you feeling better. Number 1 is lean protein. So chicken breast, turkey, fish. These proteins are great for your GI tract, great for your gut microbiome, but it does not stimulate high bile production, which will make it easier for you to digest once you've had your gallbladder removed. They're lower in fat, what makes it a lot more easier to digest and pass through your GI tract. Number 2 are high fiber foods. I love fiber. Fiber is the foundation for gut health, but fiber also helps to bind up that bile as well. So the more fruits and vegetables you can incorporate into your diet, the more fiber you're gonna have, the easier it's gonna be for you to digest the foods after your gallbladder has been removed. So load up on those vegetables, those fruits, and those whole grains like brown rice and quinoa. Number 3, I mentioned this before, but low-fat dairy or plant alternatives. So high fat's not good for you, but low fat is perfectly fine because you're not stimulating the bile production, and having plants is a good alternative to have instead of having the regular milk to make it easier for you to digest and make it easier for things to go down. Number 4 are healthy fats. Now, I don't want you to eliminate all fats because fats are good for you, especially healthy fats. So aim for the ones like nuts, walnuts, olive oil, avocado. These are easier for your body to digest in smaller amounts. And lastly, change how you eat. Having small, frequent meals will make it easier for you once you've had your gallbladder removed. Having 3 large meals will stimulate more bile production in one certain area to have more bile being secreted into your stomach to cause worsening GI issues to occur. So try to alternate with smaller, frequent meals throughout the day to make it easier for your gut and hopefully allow your GI tract to settle down and get you feeling better. Listen, I don't want you to suffer if you've had your gallbladder removed, so take these tips and see if it works for you to hopefully improve how you're eating, improve how you feel, so you're not having to have all sorts of GI issues after your gallbladder has been removed. And as always, if you are worried about your gallbladder, having gallbladder issues, if you're having pain with your gut, you don't know what's going on, myself and my team, we are here to help you. We are here to find out the root cause, get you an answer, get you a treatment option, and also treat you the way you want to be treated, whether it's natural options or medical therapy as well. Come see us. We're here to help you. Don't need a referral. Click on the link in the bio to get more information. Just get your appointment today. Don't forget to like, share, and subscribe your videos. Take care of your gut because your gut will take care of you. We'll look forward to seeing you guys on the next podcast and video. Stay healthy, my friends.